So my practice is about 50% cosmetic or aesthetic surgery and 50% breast-related insurance-covered surgery. So I see patients with breast cancer. I see patients that have large breasts that are causing physical problems, and I'll see patients with skin cancers, the most common insurance things. For the cosmetic stuff, I'll see patients that want facial rejuvenation, that want mommy makeovers, for lack of a better word, which is usually a tummy tuck, remove extra skin or tighten the muscles after pregnancy, do breast lifts for postpartum atrophy of the breast as well as drooping of the breast. I'll see patients for breast augmentation and breast enhancement. And I see a lot of patients that have body surgery after massive weight loss. So patients that have lost 100, 200 pounds. I've seen patients who have lost as much as 300 or 400 pounds, and we do extensive surgery on those to kind of get rid of the extra skin. The other things that can be seen, since it's such a broad spectrum, it goes all the way from congenital abnormalities or birth defects involving the face, hands, and or feet, or other parts of the body. We see breast abnormalities that are also congenital. There are lots of other cancer problems that will require reconstruction, whether big soft tissue tumors that need to be removed and how to get them back. How to restore that area of the body. Hand and upper extremities, such as nerve compressions like carpal tunnel syndrome, or tendon or even fractures. We do hand fractures and facial fractures. That's part of what we do also, including plating and screwing fractures with patients from the emergency room and from trauma victims that have those type of fractures. So the patient visits are either a new patient, post-operative care, or return. So they're already pretty much healed by their operation. We're just following them. So they're obviously very different, very depending upon the type of visit. But a new patient comes in, and we find out what the issue that exists, whether it's, let's say, breast cancer and breast reconstruction, or they have, for a baby, has a cleft lip with the lip didn't form properly, or the patient has a hand problem or something like that. And then we take the history, we find out what's going on, we review their entire medical history and medical conditions that may impact on how surgery is done or what their risks of surgery are. And then we'll, of course, then examine them. And then we will explain to them what their diagnosis is and what type of treatment we recommend. And then if it's a surgical treatment, we'll obviously go into in-depth explaining the surgery, the type of surgery, its recovery, its risks and complications. Post-operative care is patient gets a breast reduction operation, for instance, and they come back in a couple days. We just examine the breast, make sure that they're healing fine, there's no infection, and that goes on for several visits. And then the follow-up visits, and those usually take obviously a lot less time than the first visit. Then the follow-up visit is a few months later, to make sure everything continues to heal, the scars are doing nice, the scars are maturing properly, and those take up less time as well. So most patients usually are not seeing us after 3 to 4 months because they're totally healed. But I personally continue seeing breast reconstruction patients indefinitely. So I've followed patients up for 20 years now, actually. So we interact with multiple specialties, virtually every specialty there is. So it can be pediatrics, internal medicine, with other surgical specialties including neurosurgery, urology, otolaryngology, and orthopedics. The people we interact most with are probably the general surgeons because of breast cancer. Breast cancer is unfortunately very common, and that's probably one of the biggest impacts that plastic surgery has had in treatment of women, is that the reconstructive methods have gotten so good that the volume of reconstructive surgery being done for breast cancer has really significantly increased over the past many years compared to 20 more years ago. So it's a specialty that really transcends multiple specialties, including radiation oncology because of the cancer we're dealing with, and endocrinology because of diabetes. It really would really affect multiple specialties, and we work with them.